Hello everyone, my name is Christopher Neff, and today I'm going to present my presentation on the Alzheimer's disease. So what is Alzheimer's? Well, Alzheimer's is a progressive neurodegenerative disorder. What is neurodegeneration? It is the progressive loss of structure or the function of the neurons, including the death of the neurons. According to Chapter 22 of the Clinical Adult Neurology, it is the leading cause of dementia. Dementia is the decline of memory, language, problem solving, and other thinking skills required to live your daily lives. What are the risk factors for the Alzheimer's disease? Well, the biggest one is age. As you get older, the chances of getting Alzheimer's increases. After the age of 65, the chances of having Alzheimer's doubles every 5 years. When you reach the age of 85, the chances increase to 1 out of 3. Your family history and genetics also plays a role in this disease. For example, if your parents have Alzheimer's, your chances of having the disease are 3 times higher. Later on in this presentation, we're going to be discussing the polyprotein E genotype and how it plays a role. Your health also plays an effect on the disease. You want to try to live a healthier life to prevent earlier development of Alzheimer's, diabetes, obesity, high cholesterol, and traumatic brain injuries increases the earlier development of the Alzheimer's disease. When you take a look inside the brain of an Alzheimer's patient, you're going to see plaques and tangles. The plaques are made from the protein beta amyloid. The tangles are made from the tau proteins, which are the microtubules in your neurons which denature. The plaques and the tangles build up over time and become toxins to your neuron. Choline esterase inhibitors is a treatment, which is a symptomatic treatment that treats some of the symptoms of the Alzheimer's disease. Choline esterase inhibitors work by increasing levels of acetylcholine, a chemical messenger involved in memory, judgment, and other thought processes. They inhibit the enzyme acetylcholine esterase. Normally, the brain can produce acetylcholine. However, the Alzheimer's disease damages the cells that produce it. In this diagram explains the process. Acetylcholine is produced and used as a chemical messenger. The enzyme usually breaks it down. By using the acetylcholine esterase inhibitors, we can block the enzyme, therefore increasing levels of acetylcholine in the brain, helping with memory and other thought processes. This information came from the Journal of Enzyme Inhibition and Medicinal Chemistry. Right here is a diagram explaining a current state of the disease. Right now, we only have 5 symptomatic treatments to treat the disease. Remember, they only treat the symptoms of the disease. What we are trying to develop today are disease modification therapies. What we are trying to treat with the disease is the amyloid beta, preventing it from forming and destroying any amyloid plaques in your brain, and the same goes with the tau proteins. We are also trying to target other things involved in the disease. We're also trying to develop more symptomatic therapies to deal with the symptoms of the Alzheimer's disease. Alzheimer's is a very complex disease, and therefore a lot of treatments don't pass all the clinical trials. Hopefully, in the future, they develop some. A polyprotein E has 3 different forms. There's E4, E3, and E2. They increases your chances for the Alzheimer's disease, as you have E4, E3 is neutral, and E2 prolongs the time for the development of the Alzheimer's disease. So you don't really want to have E4, you want to have E2 because it prevents the Alzheimer's disease at an earlier age and slows down the progression of the disease. That information came from the Medical Journal of Indonesia. The diagnosis, this is the last thing we're going to be talking about with this disease. Physician evaluation, memory testing are classical ways to how we diagnose the disease. We also use PET scans. So these work by using radioactive isomers, and we scan for amyloid beta and the tau proteins. That was information that came from the Alzheimer's Resource and Therapy. On the horizon is a blood test. This blood test has a 94% accuracy rate, and we're going to use this treatment to screen for people who have Alzheimer's, so they can get the expensive treatments like the brain scans and the spinal fluid examinations. The only other way we can look for the Alzheimer's is a brain autopsy, which is a guaranteed way to see if you have the Alzheimer's disease. This information came from the BNC Neurology. Here are all my sources for this presentation, and hopefully you enjoyed the presentation and have a nice day.